So testosterone. There are millions of men who have low testosterone suffering from some of the symptoms of low testosterone, from low mood.
When women cannot make muscle, they also lose that sort of the same thing we were talking about earlier, the energy, that drive, that sort of desire for life.
Testosterone for the purposes of increasing my bench press or building a 20-inch arm. It's not legal in the United States. Good afternoon, everybody. I'm Rick Collins. I've been describing myself lately as the attorney for the fit and jacked. So if you're fit, jacked, or both fit and jacked, and you have a sort of crisis, I'm sort of the crisis manager from the legal perspective for those things. So the disclaimer we always give is nothing we say is to be construed as legal or medical advice. This is simply for informational purposes only, and nothing creates an attorney-client or doctor-patient relationship with anybody who's on the panel. And with that, we start. Take it away.
All right, thanks, Rick. So, like we did in the past panels, I think, Rick, you already introduced yourself as our resident attorney on the panel. My name is Mike Kocsis. I'm the founder of Balance My Hormones. So testosterone, it seems like it's more than just a hormone. There are millions of men who have low testosterone suffering from some of the symptoms of low testosterone, from low mood, to lack of libido, to lack of vitality, difficulty sleeping. There are many, many symptoms of low testosterone. Today, we hope to dive deep into some of the areas of testosterone replacement therapy, what it entails, and we've got this wonderful panel to discuss their professional opinions on the use of testosterone replacement therapy. So why don't we get started with our first question and how testosterone replacement therapy is also changing lives. So one of the first questions I want to ask everyone are, we all hear about testosterone. Everything is lately testosterone this, testosterone that. But what are some of the surprising benefits of testosterone replacement therapy, or even testosterone itself, if you have optimal levels?
So the number one benefit of testosterone replacement, or optimization therapy, as I like to coin it, is the improvement in cognition. So most men and women don't realize when they ask me the question all the time, like, hey man, what's your favorite nootropic? Like, what peptide or what supplement is your favorite nootropic? And I always tell them testosterone, because testosterone has incredible benefits and effects in dopamine signaling, improving both short and long-term memory. I mean, it does so many things for the brain. And a lot of guys and women, of course, who are suffering from a testosterone deficiency. And by the way, that is, I would say, hundreds of millions of people around the world, and the majority of them are undiagnosed. They have no idea. Again, due to what we were talking about yesterday, the environmental decay, blue light, EMF, electromagnetic, dirty electromagnetic frequencies. There's so many things contributing to the decimation of male and female endocrine systems, but it's incredible to see what happens to both men and women who begin testosterone optimization in improving their mood. Okay, a lot of people obviously associate testosterone with libido improvement or improving sexual function, but in fact, that's usually one of the last things that you see. You first see the dopamine signaling improvement, which automatically is going to improve mood. A lot of people who are depressed, who are prescribed SSRIs, which, as you guys know, are selective serotonin reuptake inhibitor, mood-altering drugs, would be much better served if they were prescribed testosterone earlier on. But again, unfortunately, we don't have a lot of physicians in the world trained on prescribing therapeutic testosterone. But thankfully, due to this panel and due to the worldwide, I would say, onset of people understanding now that there are massive, societal-wide hormonal deficiencies, it's becoming more mainstream now for people to seek this out.
I agree with what Jay said. The mental, emotional aspect is massively important, both for men and for women, and of course everyone knows about some of the other benefits. But the other thing is its effect on reducing inflammation and reducing visceral fat. as everybody knows, obesity, metabolic syndrome, insulin resistance is an epidemic proportions in the country and around the world for that matter. It's one of the leading causes of comorbid diseases, a lot of the chronic diseases we see. So the key is really to address that. Obviously, lifestyle, diet, exercise, et cetera. I always harp on, everyone here harps on that. But in terms of testosterone, the mental aspect, the people like, I know I need to get to the gym, but I have no drive or desire. That, as Jay said, will help. But once it takes effect and you're doing the lifestyle issues, you're doing everything at once, like we talked about yesterday, reducing that inflammatory process is underappreciated, improving biomarkers, improving your lipids, and then, of course, helping reduce visceral fat, which everyone has and is a highly inflammatory material in our bodies, right, in our gut, getting that deep visceral fat that causes so many inflammatory processes. It's rampant. It's the big uptick in diabetes and metabolic syndrome. It's crucial for that, and we see more and more of that along with all the other hormones.
I just want to add that there's all the obvious effects that everybody's talked about here, including things like muscle building, cognitive effects. It's extremely cardioprotective. We used to be actually afraid of testosterone for cardiac and say it was not good for the heart. We actually know it's actually very cardioprotective. So there's all these kind of unseen benefits. It's also very immunoprotective. So the immune system is dependent on testosterone levels as well. And it's one of the reasons actually men thrive better a little bit when they're younger than women in terms of autoimmune diseases is because they have more testosterone. So I really think that there's a lot of critical pieces. And I actually, the panel that was up here before, one of the discussions was, should you treat a low testosterone if somebody feels good? And they said no. And I would say yes. Even if you feel great, and I measure your testosterone levels and there's low, there are bad things happening to you that you do not know. And so I do think you want to optimize levels even in somebody who feels healthy. I'm also going to add, because without Allie here, I'm always the only female, that it gets so forgotten in women. And women's testosterone levels drop. We've got only a few women in the crowd, but women's testosterone levels are low really quite young. I mean, a lot of women are 20s, and we talked in the panel we were on earlier in the exhibit hall about birth control pills and what they do to testosterone levels. I mean, they tank testosterone levels, and sometimes even long after you stop birth control pills. For years after, you can see elevations of sex hormone binding globulin, which binds out your testosterone, and you have very, very low levels of testosterone. And that can maintain long after you stop that. So women lots of times get very neglected in this realm. And I think particularly younger women, sometimes older women, it gets thought of at least a little bit, but not in younger women. So we really need to be very cognizant of females, but also I think just optimizing levels in everybody, even in people who do feel well.
I was going to just add to that is with menopause and perimenopause, it's well accepted, more accepted, not everywhere, for women to receive testosterone treatment. But how would what would you tell other doctors that may want to prescribe testosterone for women who might have suffered from elevated SHBG, low testosterone as a result of birth control? I mean, maybe from a legal point of view or even from doctor to doctor. What would you recommend to tell other doctors to encourage them that this might be a good approach?
Well, gosh, I get this so much because I'll put a woman on testosterone and they'll go see a doctor who says, you don't need, why are you on testosterone? You don't need testosterone. And, obviously we don't need the levels males do, but without testosterone, women cannot make muscle. They also lose that sort of, the same thing we were talking about earlier, the energy, that drive, that sort of desire for life. So a lot of that depression that you see in perimenopausal women, and even younger women, that's why birth control pills can be linked to depression, is that low testosterone level. So I have this argument constantly with other physicians who are, and me, my background is actually orthopedic, so I came into this from this sort of weird world. So I use testosterone a lot for healing, and my partners would be like, what are you doing? Because it's so critical to healing tissue. So I think that all you can do, because it's sometimes very hard to educate other physicians, is educate patients and hopefully they can understand. So I spend a lot of time educating my patients, and I have given up on a lot of doctors. But if I can educate the patients, the hope is that they can go there and at least have the data to support why they're doing this.
Rick, do you have any legal advice for that?
Well, sure. So, first of all, it's wonderful to have a panel of doctors who are knowledgeable and progressive in their thinking with respect to testosterone. I've dealt through my career with a lot of doctors who are not. And I would say that the standard is doctors are incredibly ill-informed on testosterone. There's a bias against testosterone. I've represented doctors who were practicing, age management practice in a beneficial way, who were targeted by very conservative endocrinology-based medical licensing boards, and were dragged in front of board hearings to explain why they were prescribing testosterone in a very forward-thinking, aggressive kind of way. And so very often, I think if you ask the average general practitioner about, for example, whether testosterone causes prostate cancer, or whether testosterone is beneficial for the heart, the average GP is going to say no. These things are terrible. They'll cause prostate. And so, and I've asked some of my friends who are doctors, not in this world, but in nephrology or other more traditional areas of medicine, what training did you get? How much information did you receive in medical school about testosterone or about anabolic steroids? And it's very, very limited, if any. And so it's wonderful to have progressive thinkers in this area. The problem from a legal perspective is that traditional medicine has not caught up. And so there is some doctors who are very, very aggressive in testosterone replacement therapy do get targeted. And the difference and the problem here in the United States, of course, is that testosterone is a Schedule III controlled substance. And what that means is that it can only be prescribed for a legitimate medical purpose in the usual course of a medical practice, of a professional practice. And testosterone for the purposes of increasing my bench press or building a 20-inch arm is not adequate, is not legal in the United States. And so there's sometimes a gray area that, between what's medical and what is perhaps cosmetic, because one of the byproducts of the medical treatment is a cosmetic improvement. Like Eric just said, you'll lose some body fat, you'll gain muscle and improve your body composition, and that's particularly if you were in a deficient state. So that's a wonderful thing. But to sort of wrap it up, it's wonderful to have forward-thinking medicine, and perhaps whether it's just educating patients for now, but hopefully also educating doctors in the long term, so that kind of stigma that's attached to testosterone that dates back to the 1988 Seoul Olympics, when Ben Johnson used anabolic steroids and beat the American Carl Lewis in the '88 Olympics in Seoul. There's this stigma attached to testosterone and anabolic steroids that I think it's time to really revisit.
Absolutely, but even in the UK recently there was a panorama. It's kind of an undercover program that revealed HRT doctors prescribing too much estradiol. So even estrogen, any hormones can be demonized. And in fact, they were saying that the doctor prescribed too high of a dose of estrogen cream. So I can only imagine in the UK if some of our forward-thinking doctors, and that was a forward-thinking doctor, wanted to prescribe testosterone to a woman who wasn't perimenopausal or didn't have the right symptoms of low libido who were menopausal, it might be a bit difficult at this point in time. But everything eventually reaches UK shores, usually about 10 years after it's come into the United States. So I guess to sum up, and if anyone else has any thoughts on surprising benefits of testosterone replacement therapy, we've heard that there are benefits for women. We've heard there are metabolic benefits from Eric, as well as mind benefits from dopamine from Jay, and Nathan, you also had some benefits to talk about.
So in my world, when you're feeding individuals who might be 6'8", 430 pounds, they're pounding an incredible amount of food. When you're pounding an incredible amount of food, you're tasking the body when it comes to your digestive capabilities. And one of the extreme benefits, again, in my world, how that pertains to the athletes, making sure that the testosterone levels are optimized, is that has an incredible effect on the enzymatic environment of that individual's digestive enzymes system. So it keeps the balance of the digestive enzymes, because testosterone is an amazing governor of that. When your testosterone levels are lower, your digestive enzyme balance tends to either get out of whack or it tends to also drop. Having the right amount of digestive enzymes ensures that your body is properly and efficiently digesting the food that you're eating, especially when it's in large quantities, which has a dramatic impact on your insulin's ability to take those macros and shuttle them off to where they go, because testosterone also helps to increase insulin sensitivity. So when you have all those things working together, it's an incredible companion to make sure that you're getting the benefits out of your diet. Whatever type of diet you choose to follow, you get those intended results.
Thanks for that. So, you know, with TRT, and a lot of younger men are now coming forward thinking they might have low testosterone. I mean, it's kind of all around them, whether it's TikTok or if it's YouTube or anywhere on social media. I guess as practitioners, how do you ensure that the testosterone is being appropriately, and maybe that's a bad question because it's making it sound like it's inappropriate to give a young person testosterone, but we talked a little bit about this earlier in other panels. How do we ensure that it's safe and effective for young people, and how do we determine who might best benefit from the testosterone? I mean, obviously, we all know there are lagging testosterone levels across the population, males and females, and younger males are starting to have the symptoms of low testosterone. I mean, is this something that maybe we ought to screen during puberty for? Because many men will be overlooked and have lifelong issues if basically testosterone deficiency through puberty. What do you guys think?
So here's what Rick was talking about. Here's where the problem is getting, and you guys are seeing this in your practices now, is that more and more younger people are suffering deficiencies. And it's happening, as you know, and of course, Eric, as you know, to kids literally who are teenagers in their early 20s. And this is all due to social media. Their dopaminergic signal pathways are being hijacked by YouTube, by porn, by video games. I mean, all the blue light frequencies that they're constantly absorbed in and bathed in. And a lot of these kids today, I mean, again, the statistics are shocking. I tell people this all the time, and people don't even believe this, but in 2022 and 2023, 50% of males in the United States and Canada, 50%, you guys can fact check me on this, did not have sex one time with another person, male or female. So we have this lost generation of both men and, of course, the women, because if they're not having sex, if the men aren't having sex, they don't have anybody to have sex with. It's really bizarre, and that's what we're seeing. And so their issue now is, as Rick said, the traditional medicine has not caught up to the aspect that you can treat a younger person with therapeutic testosterone. And I'll let you guys talk to what you can do, obviously, because there are adjuvants like Clomid and HCG and all the other things. But it's really becoming difficult for a physician in today's day and age to truly give the younger person the therapy that they require or ultimately desire because of the legal reasons of treating someone who's so young.
Well, I think that in answer to the question, you're right, Jay, that we're seeing this drop in hormones very early. And I'll tell you, COVID did a number of this, as did the COVID vaccine, that actually really tanked people's levels, sustained. We're seeing a lot of sustained low levels. I'm an advocate for early screening of everything. I think everybody should be starting to test their labs at a young age. I think that nobody starts thinking about their health until they're 50, and the problem is that there's a lot of damage done in that time. In my ideal world, the 18-year-olds should know what their levels are. Even if they're good. Now we have a nice baseline so that 10 years from now, if they've dropped, well, this is what I used to be, right? And you should be staying at those levels. So I'm an advocate for everybody should know their lipid profiles early. They should know what their thyroid is early. They should know what their CBC, their CMP. I'm an advocate for everybody should have labs done early, and they should be following them on a regular basis. We have the ability to get the data, and get it young when you can actually intervene early before damage is done. Prevention is always better than trying to play catch-up. I don't think people start doing that until it's too late. As far as treating young people, I think obviously the first thing is trying to get their health back, which would be trying to get them to eat well, stop alcohol, get outside, do those things, as opposed to just throwing them all on testosterone. The problem is, how do you do that? I have 5 kids who are all sitting here, and I can tell you, trying to have a conversation with them about not drinking in college, they're like, How do you do that, right? Right? It's a very hard discussion to have. That's what college is, right? You go and you party and you drink and you eat pizza and you eat badly. So how do we work with these people sensibly to try and do things that are going to help their health? But I do think that we're finding young people where you do have to engage in treatment. And that's where you can use HCG, you can use enclomiphene, and hopefully now with this new oral testosterone, Kysotrex, which has no effect on testicular function, it might be a nice option to use a low-dose Kysotrex with these people. This is a new oral testosterone that does not affect testicular function, that does not affect liver, and is very, gets nice levels that will just boost them up a little bit. So I think there's going to be options. I don't think it should ever be the first go-to. The problem is, and that can be a whole nother discussion, how do you get young people to start attending to that? I don't know.
You mentioned the oral testosterone. A couple of years ago, there was talk about the nasal testosterone also wouldn't lower the HPTA axis. Essentially, you can have your cake and eat it, if meaning your pituitary is still producing testosterone, and then the nasal one you would apply. Some people would say it would get closer to the brain, and you get some of the benefits of the testosterone. What do you think about the nasal testosterone as well?
No, I've not really used much of the nasal, but I'm excited about the oral form that you're talking about, Betsy, and I agree with what they both said about the modern society, and for me as for what I like to do it, and as a former ER doc, I always like to have options A, B, and C, and with the younger people, like Betsy said, there's options, Clomid or HCG or this new formulation, but sometimes it's just a root cause thing, right? It might be one inciting event, especially when you're younger, someone had an accident or they had an illness or something, and we can fix that. As with everything, is there an underlying cause? Let's fix that, and boom, we kind of reset them, and maybe they're good. Or it might be a lifestyle issue that needs to be addressed aggressively. But there are, as I think we're all seeing, as more and more people where that is being done, but they still might need treatment. So I think the trend, as Jay said, the trend is lower and lower, early and early. I'm seeing this all the time, lower and lower numbers, more and more symptomatic. So it may merit that conversation. But I think for me, I like to start with an early plan of saving testosterone for last and say, okay, we tried all this and it didn't work. Now we need to reboot you and maybe take you off it or maybe continue. But now we have some better options. So I think that's a good way to do it.
So I have used the nasal testosterone in my patients. It's hard to get levels up very much. I have not used it in younger patients. Maybe that would be a good place for them. It's also pretty uncomfortable. Guys feel like it kind of burns their nose and it feels like it drips out of their nose a lot. So I didn't get a lot of good use of it. People didn't like it very much. But I have tried it. I was actually pretty enthused by it. I think it still might be a nice option for some people. I'm going to add to what Eric said on the young people. One of the things to remember is head, because you were talking about the pituitary, is even mild head injury. So any of you guys who played football or have had multiple concussions, the pituitary does get damaged. You see what's called empty cella syndrome. The pituitary is no longer actually cueing the testicles to make testosterone. So that's actually a really good group to keep in mind, because a lot more people now, we're seeing these football players who have chronic head injuries, or any of these athletes who have chronic head injuries. Anybody who's had chronic head trauma very often at a very young age has low testosterone.
Yeah, I believe the main hesitation of young people to follow TRT is the lifetime commitment and the thing that they're kind of scared they have to follow this for the rest of their lives. And unfortunately, urologists are not aware of that, and they tell them, oh, you're going to be infertile and sterilized, because they're not aware, obviously, by the implementation of HCG. And yes, if you take testosterone, the testicles will shrink, will diminish in size. The point is you can maintain fertility by the use of HCG, and urologists are not aware of this. And I'm a living example that at 10 years now, testosterone was able to become a father. So the lack of knowledge, and this is out of knowledge, then the prejudice, skepticism, and the negativity makes them to avoid the initiation of TRT in young people.
That's a good point, George. So that leads me into the other question is, in a lot of men, or even women, mostly men in this regard, there's an uncertainty about the long-term commitment to TRT. And I think in the past this was more so, and now it's becoming a bit more common, or maybe it's just because I'm so ingrained into this field that I just think everyone thinks like me. And I was one of those young people at 22 when I started TRT, and then it wasn't common then, maybe for older men, but not for younger men to be on testosterone, and I had multiple tests done. But I guess the question is, what, as practitioners and advocates, can we say to young people, or anyone starting TRT, about this lifelong commitment? And because that can be quite scary, any sort of long-term commitment to be on a treatment. So anyway, my point of view is I don't want to be thinking of it as being a sick patient.
When they go to the endocrinologist and they say, oh, you need to take T4 for the rest of your life, are there any hesitations there? No. They're taking thyroid because every kind of hypo means you have the deficiency, you have to take it for the rest of your life, okay? So there's no hesitation over thyroid. Why then not take testosterone?
Right, we get this with all hormones, right? I mean, I get a lot of women who I put on hormones, testosterone, estrogen, and then their doctor's like, well, you're too old, you don't need it anymore. And it's like, so yes, you will, this is a commitment, just like everything you're going to do to try and stay young is going to be trying to maintain these levels we had when we were 18 and trying to maintain them our whole life. That is going to be a lifelong commitment. I will stop my hormones when I die, and that's, and not before that. And I think that's what everybody should do, because you have to maintain those levels to maintain health. So it's silly to say, well, I have to do this for the rest of my life. Yes, you do, just like you have to eat healthy for the rest of your life and exercise for the rest of your life and do all those other things. Maybe a pain in the butt, but you have to.
I think for any person, and obviously there's plenty of people in this room and everyone sitting up on this stage or panel right now, the difference between being on testosterone and optimized on testosterone and not be is so great that very few of us, when experiencing that benefit, would ever think, oh, the matrix may collapse and, we might get hit by an EMP. Do you know how many times people have messaged me in the last 10 years where they're like, dude, what happens if I can't get my testosterone? And I'm like, well, you're going to have to save up for a rainy day, bro. But no, I mean, the truth is that the reality is that you're not going to ever look at it as like, oh, I have to be on this the rest of my life. You're going to actually be grateful when you look in the mirror every day and say, oh my God, I'm so glad that I'm on this, because I know what I felt like previous to this. I felt like dog, you know what? And now I feel amazing. Now, obviously, it's important for you guys out there that are not on testosterone or thinking about it, and again, whether you're male or female, that you work with a physician of the caliber that understands how to do it, because as Rick was saying earlier, 95% of doctors have absolutely no idea how to get you optimized on testosterone. And that includes the majority of them, as you know, that have clinics, okay? Because these guys that are on the corner that are charging you $199 to get your hormones optimized likely have no idea what they're doing. So you have to be very, very cautious and prudent and intelligent and investigative and discerning before you choose who to work with. And again, ask that guy down there at the end. He can talk to you about the stories of people that do things that they shouldn't be doing as doctors. So it's critically important, but I always look at it as, again, the glass half full scenario. It's like, I want to be on testosterone and I'm going to do everything in my power from an abundance mindset to be continually on testosterone until I die, because the lack of being on testosterone sucks.